Welcome back, future orthodontists. Today we explore palatally displaced maxillary canines, one of the most common impaction problems. A palatally displaced maxillary canine erupts towards the palate instead of its normal position in the dental arch. It may be impacted or partially erupted. Remember the mnemonic PDC, palatal displaced canine. Causes include genetic predisposition, crowding of the anterior segment, prolonged retention of primary canines, abnormal eruption path, and supernumerary teeth or cysts. Use the mnemonic GCRAS: genetics, crowding, retained primary, abnormal path, supernumerary. Etiology helps in early detection and planning intervention. Diagnosis involves clinical examination by palpating the canine bulge in the palate. Radiographs such as panoramic, periapical, or CBCT if needed, and assessment of occlusion, crowding, and symmetry. Mnemonic CRA, clinical, radiograph, assessment. Early diagnosis prevents complex treatment later. Management depends on age, severity, and space availability. Observation is possible if there is minimal displacement and adequate space. Extraction of primary canines can guide eruption. Orthodontic traction uses fixed appliances to bring the canine into the arch. Surgical exposure is required for impacted canines. Mnemonic OETS: observe, extract primary, traction, surgery. Customized approach ensures predictable and aesthetic results. To summarize, palatally displaced canines essentials are definition PDC, palatal displaced canine, etiology GCRAS, genetics, crowding, retained primary, abnormal path, supernumerary, diagnosis CRA, clinical, radiograph, assessment, management OETS, observe, extract primary, traction, surgery. Quiz time. Question 1. What does PDC stand for? Question 2. What are common causes of palatal canine displacement? Question 3. Which diagnostic methods are used? Question 4. Management options include what? Excellent! You now understand palatally displaced maxillary canines, their causes, diagnosis, and management. Next video, increased overjet.